Do you notice that your legs, ankles, or hands are becoming more and more swollen? Did they tell you that fluid retention is normal after 60? From now on, I tell you that it is not. I am Dr. Sinclair, and in this video, you will understand what is behind fluid retention, why it happens, when it is normal, when it is not, and what real actions can help you improve it before it affects your health. What fluid retention really is and why it occurs. Fluid retention, also called edema, is not a disease in itself, but a sign that something in the body's internal balance is not working as it should. The human body is designed to maintain a very precise balance between the fluid that enters the tissues and the fluid that leaves through the circulatory and lymphatic systems. When that balance is disrupted, fluid begins to accumulate in the spaces between cells. This is what causes swelling, a feeling of heaviness, stiffness, and in some cases, pain. This process does not appear overnight. It usually develops gradually and silently. The most common cause is an alteration in venous circulation. Veins are responsible for returning blood to the heart, and when that return becomes inefficient, pressure inside the vessels increases and fluid leaks into the tissues. The lymphatic system can also be involved, as it is responsible for draining excess fluid and proteins. If this system slows down or becomes overloaded, edema becomes more noticeable. After the age of 60, this process becomes more common because several mechanisms change at the same time. Muscle strength decreases, especially in the legs, which reduces the pumping action that helps venous return. Venous valves may weaken. Low-grade inflammation increases. The kidneys may become less efficient at eliminating sodium and water. All of this creates a favorable environment for fluid retention. Is it more common in men or in women? Fluid retention is more frequent in women, especially throughout adult life, due to hormonal influence. Estrogens promote sodium and water retention, and hormonal changes during menopause further disrupt this balance. However, at older ages, the difference between men and women becomes smaller. In older men, fluid retention is more often associated with cardiovascular, kidney, or liver problems. In women, it more commonly combines with venous insufficiency, varicose veins, and persistent hormonal changes. In both cases, it should not be normalized as just part of aging. Clinical and epidemiological studies show that chronic edema in older adults is associated with a higher risk of functional decline, falls, skin infections, and reduced quality of life. It is not just a cosmetic or temporary issue. There are factors that clearly increase the risk. Sedentary behavior is one of the main ones. Spending many hours sitting or standing without moving slows circulation and promotes fluid accumulation in the lower extremities. Chronic venous insufficiency, varicose veins, and a history of thrombosis also increase risk. Heart disease is another major cause. When the heart does not pump effectively enough, blood backs up and fluid leaks into the tissues. Kidney disease affects the ability to eliminate sodium and water. Liver disease alters pressure within blood vessels and the production of proteins needed to keep fluid inside the circulatory system. Other risk factors include excess body weight, diabetes, poorly controlled high blood pressure, high salt intake, frequent alcohol consumption, certain medications, such as anti-inflammatory drugs, corticosteroids, or some blood pressure medications, and chronic dehydration, which paradoxically encourages the body to retain fluids as a defensive mechanism. What worsens fluid retention? Many everyday habits silently worsen fluid retention without people realizing it. One of the most important is frequent consumption of ultra-processed foods. These products not only contain large amounts of salt, but also hidden sodium in preservatives, flavor enhancers, and additives. Even if they do not taste salty, they keep the body in a constant state of retention. The body interprets this excess sodium as a threat to internal balance and responds by retaining water to dilute it, which promotes persistent swelling, especially in the legs, ankles, and feet. Drinking too little water is another key factor that is often misunderstood. Many people believe that if they retain fluids, they should drink less water. In reality, the opposite is true. When hydration is insufficient, the kidneys activate conservation mechanisms, retain sodium and water, and worsen edema. Mild but sustained dehydration is one of the most common causes of chronic fluid retention in older adults. Prolonged inactivity also plays a central role. Sitting or standing for many hours without moving slows venous and lymphatic return. Crossing the legs for long periods compresses veins, impairs blood flow, and favors fluid accumulation in the lower body. The same happens with very tight clothing, especially around the waist, groin, or behind the knees, which acts as a mechanical barrier to circulation. Poor or irregular sleep worsens fluid retention more than many people imagine. Poor rest disrupts key hormones such as cortisol and aldosterone, both involved in fluid and sodium regulation. Chronic stress keeps the body in a constant state of alert, raises cortisol levels, promotes inflammation, and alters vascular balance. Added to this is excessive heat, which dilates blood vessels and makes it easier for fluid to leak into tissues, intensifying swelling, especially in warm climates or during summer. What really helps improve it? Improving fluid retention does not depend on a single measure, but on the combination of simple actions sustained over time. Daily movement is one of the most effective and accessible tools. Walking regularly, even at a moderate pace, activates the muscle pump in the legs and facilitates venous return. Moving the ankles, bending and extending the legs, changing position frequently, and avoiding long periods of immobility also stimulate the lymphatic system, which plays a key role in draining excess fluid. Elevating the legs for a few minutes a day, especially during rest or before bedtime, helps accumulated fluid return to the circulatory system. These do not need to be extreme positions, but rather small, consistent gestures that relieve venous pressure and reduce the feeling of heaviness. Diet has a direct and profound impact. Reducing both visible salt and hidden salt is essential. Prioritizing fresh, natural foods, vegetables, fruits, legumes, high-quality proteins, and healthy fats improves kidney and vascular function. Adequate hydration, spread throughout the day, helps the kidneys eliminate sodium more efficiently and prevents defensive retention mechanisms. Various studies show that a diet rich in potassium, found in fruits, vegetables, legumes, and natural foods, helps balance the effects of sodium and promotes fluid elimination. This does not mean uncontrolled supplementation, but rather a varied and balanced diet. Maintaining a healthy weight reduces pressure on the venous and lymphatic systems. Wearing comfortable, stable footwear improves walking and leg muscle function. Taking care of the skin, especially in areas affected by edema, helps prevent complications. In some cases, the use of compression stockings prescribed by a professional can be very helpful in improving venous return. Sleeping well, maintaining regular rest schedules, and reducing daily stress also have a real impact. When the nervous system is balanced, the hormones that regulate fluids and blood pressure work better. Fluid retention improves when the body is no longer in a constant state of alarm. Small, sustained changes are more effective than quick fixes. The body responds when balance is restored. When to see a doctor without delay. Not all fluid retention is benign. It is important to seek medical evaluation if swelling appears suddenly, affects only one leg, is accompanied by pain, redness, or warmth. If there is shortness of breath, chest pain, rapid weight gain, facial or abdominal swelling, or if it does not improve with rest and movement. It should also be evaluated when edema progresses, becomes persistent, or interferes with mobility. Fluid retention can be the first visible sign of a heart, kidney, or liver problem that requires diagnosis and treatment. Fluid retention is not just extra water, it is a message from the body. Listening to it in time allows you to act before the problem advances and affects autonomy, mobility, and quality of life. Now tell me honestly, have you noticed frequent swelling in your legs, hands, or feet? I read you in the comments, and if you made it this far, write, I take care of my circulation because yes, health always comes first.